Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again. But for our radio audience here in Mississippi at WYAD 94.1 FM and WYADonline.com, we're glad that you all could be with us. Also, joining us are our friends at Amazon Music as well as iHeartRadio. We're glad you all could be with us as well. This is part of our News You Can Use segment here at WYAD. We all have heard about anemia or someone being anemic, but have you heard of iron deficiency anemia, which is a condition that's affecting over 6.5 million Americans today? Here to talk to you all about not only what it is, but also how you can be able to prevent the condition. We're excited to welcome a very special guest to our program today. Dr. Gokal is joining us. We're going to talk to him not only about iron deficiency anemia, but also where you all can go for more information that you can also share with others around you as well. Dr. Gokal, thank you so much for the time. Really appreciate it.
It's my pleasure to be here on behalf of Daiichi. Thank you.
Well, Dr. Gokal, I think the big thing here is, and I noticed this when I was first telling the station about this segment, as I said, we hear about people being anemic or anemia, but what exactly is iron deficiency anemia?
That's right, Cyrus. Iron deficiency anemia, as the name suggests, has to do with low levels of iron within our body. Our red blood cells are responsible for circulating oxygen from our lungs to the rest of our organs to keep us healthy and active. When we are low in red blood cells, that's what leads to anemia.
So how's this kind of condition, Dr. Gokal, how's it originally diagnosed with a patient?
That's a great question. It's important to note that the only way to diagnose iron deficiency anemia is through specific blood tests that have to be ordered by your doctor. And it's important to point out that these are not tests that are part of routine or standard screening, such as with your annual wellness exam or a general physical. So you have to have a detailed discussion with your doctor to specifically order your iron levels.
So for our audience to be able to make that decision, if this is a conversation then they need to have with their doctor, are there any symptoms maybe they should think about if they think this is something that they're dealing with?
Absolutely. Some common symptoms include dizziness, shortness of breath with activity, generalized fatigue or weakness, pale skin or dry mouth. But it's important to point out, and what I've seen in my practice, is that many patients can have iron deficiency anemia and not have any symptoms at all.
So I think, for our audience, this is why we do these News You Can Do segments here at the radio station, Dr. Gokal, because I'm sure for a lot of our audience, they would think, okay, well, if I'm having some symptoms, then this is something I should be looking into then. Are there certain people that are at risk then for having this form of anemia?
Definitely. Women are at more risk than men. Women of childbearing age, in fact, 1 in 5 women of childbearing age will have iron deficiency anemia. And certain individuals with chronic conditions, such as heavy uterine bleeding, like heavy menstrual cycles, certain gastrointestinal conditions, like inflammatory bowel disease, such as Crohn's disease or ulcerative colitis, celiac disease, and non-dialysis dependent chronic kidney disease, are conditions that increase the risk of iron deficiency.
So, Dr. Gokal, it made me think of another question then for you, because as you said, you have seen patients yourself that have not had any symptoms. So should we then, at this point, when we are going in, let's say for our annual, that we do ask for this type of testing to be done anyway?
It is important to have that detailed discussion with your doctor, and there's a great resource at imayhaveida.com to give you detailed information on certain causes and conditions that can impact iron deficiency anemia, but also the opportunity to take a personalized quiz that can better facilitate that discussion with your doctor.
All right, and that was imayhaveida.com. We'll make sure that we link that up for our audience. Again, everyone, Dr. Neil Gokal has been our guest. Dr. Gokal, great information for our audience here in our News You Can Use segment. Thank you so much for the time today. Really appreciate it.
It was my pleasure.
And we thank your audience for tuning in to another great segment of Conversations Live. Until next time, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Now let's go make today amazing. Take care.